What Democrats and Republicans want in the government shutdown dispute. A partisan standoff in Congress has led to a government shutdown, centered on a sharp disagreement over health care funding and immigration-related provisions. Democrats are refusing to support a temporary spending measure unless it includes health care provisions they consider essential to preserving Affordable Care Act, ACA, subsidies. Republicans, meanwhile, argue that Democrats' demands would funnel taxpayer dollars to illegal immigrants and reverse reforms passed earlier this year. At issue are provisions in the One Big Beautiful Bill, OBBB, Act and the Working Families Tax Cut Act, WFTCA, both signed in July. These laws aim to ensure Medicaid, Medicare, and ACA subsidies were limited to U.S. citizens and lawful residents. Republicans, who control both chambers of Congress, have passed a clean stopgap funding bill in the House to keep the government open through November 21st, without any additional policy riders. Democrats, lacking the numbers to pass their own legislation, are using their leverage in the Senate, where 60 votes are required to advance spending bills, to push for changes. Democrats want to make permanent the enhanced ACA subsidies set to expire at the end of the year, arguing that millions of Americans could face steep premium increases if the subsidies lapse. They also seek to roll back the July provisions that restricted access to federal health programs for non-citizens, including some who entered the U.S. illegally. Section 2141 of their proposed continuing resolution would restore pre-July rules that allowed certain non-citizens to access health benefits. Democrats argue this would simply restore the status quo and deny any intent to expand health care for undocumented immigrants. Republicans counter that these rollbacks would reopen loopholes previously exploited to provide federal benefits to illegal immigrants, through emergency Medicaid reimbursements, asylum and parole classifications, and state-based financing schemes like California's. For example, OBBB ended enhanced Medicaid reimbursements to hospitals treating illegal immigrants starting in 2026, a change expected to save $28.2 billion. Democrats' bill would reverse this. It would also redefine lawfully present to again include asylum seekers and parolees, which Republicans say blurs the line between legal and illegal presence. The White House released a memo on October 1st estimating that repealing these provisions could cost nearly $200 billion over 10 years. Democrats call Republican claims misleading, insisting their focus is on protecting Americans' health care and preventing premium hikes. Republicans argue Democrats are prioritizing benefits for non-citizens over keeping the government open. This fundamental clash, health care subsidies tied to immigration policy, has stalled funding negotiations and triggered the current shutdown.